digital health of today is very focused on the system. It's very focused on connecting patients and their providers and building capacity within health systems to accommodate new technologies. And so you see examples like this. Many of you might remember when your health records were actually paper records, and now we've seen changes to electronic health records, and you may be likely to sit with your doc around a computer and have a discussion about your health. The problem with that, of course, is that your docs used to look at you in the face, and today they're more likely to look at their iPad, but that's an issue that is probably one that will be solved pretty quickly. The digital health of tomorrow, though, is going to be very focused on patient engagement. It's going to be focused on strategies for empowering patients to make good decisions for their health. And we're going to be using technologies like wearables. Many of you probably have Fitbits on your arms or other types of physical activity monitoring devices, and some of you will soon have Google Glasses on, and we'll be collecting these constant streams of data, maybe from sensors that are tattooed on your arm and that are measuring your pulse and maybe your blood glucose. We all have problems with sleep, and so I imagine a time very soon when all of us will have technologies built into our mattresses to measure our sleep behaviors. We might be using network-connected forks, again, real product, and this measures the speed with which you eat food, and we know that when you eat food more quickly, it's tied with weight gain and caloric intake. Great product. Sort of. And we may have technologies like this, the new Google product, which is designed to measure glucose in your tears. So it obviates the need to have to measure blood glucose. And you may see the network-connected toothbrush, which is designed to tackle your dental health. Now, can you imagine your toothbrush telling on you? But that's what it does. Now, all of these data streams will be integrated and refined, and we're creating new algorithms to make sense of these data and to make them actionable. And they'll be dumped into tools like Apple's new Health Kit, a data repository that's designed, it's built into all the latest versions of iOS. And I imagine many more sophisticated aggregators will be coming along very soon. But we won't just be getting our health information in our hands and in our pockets, but we'll be getting it in our cars. This is a product from Ford that's designed to prompt people who have diabetes about when they need to be testing their blood glucose. We will certainly all be getting these kinds of alerts on our watches. And for those of you who are afraid of having your blood taken, you very soon will not have to have a phlebotomist fish around in your arm because it will just be projected, your vein structure will just be projected on your arm. So that's the digital health of tomorrow, strategies to engage and empower patients, to link patients in these important ways. And this is all really exciting. In fact, many of us, given where we sit and what we do for a living, we're using some of these technologies now, and we certainly will be using them in the very near future. The costs are coming down dramatically. We're seeing rapid increases in penetration of connectedness, and so it's getting easy for people like us to use these types of technologies.